Pilavachi. I'm just here to talk a brief introduction to Medsin UK, which is a student-led global health charity and network. So what is our vision? Within Medsin, we are looking to work towards a fair and just world where equity in health is a reality for all. And the means that we choose to do this is through our mission. We're trying to create a network of students which are empowered, who are given the skills to effect tangible social and political change in health on a local, national and global level through education, advocacy and community action. And it's these three variables that we work towards that I'm going to talk to you briefly today. On a national level, our advocacy is probably what we're most well known for. We do a variety of different areas that we fight through in campaigning. We're a non-profit organisation for many activities that carry out advocacy and campaigning, trying to provide the training and skills for some of our activities, as well as doing direct advocacy ourselves. We provide a student voice to other organisations' campaigns. We sit on various different committees, hoping to provide that student perspective, but also provide the students to add add momentum to campaigns that students are particularly good at. We have various national working groups that concentrate on particular campaigns that we're working on, and a national advocacy team that are able to reply rapidly to current topics. Internationally, we provide resources, workshops and campaigns to the International Federation of Medical Students Associations, which is made up of about 100 different countries around the world and of about 3 million students. And we've worked really hard to put global health onto the IFMSA's agenda. Education. This is one of the things that we're particularly good at. Our Global Health Education Project managed to put the introduction to global health in the GMC's Tomorrow's Doctors. We've also provided a Global Health Education Toolkit, which is a very comprehensive document that allows students to be able to analyse their own school's global health curriculum and see how they can encourage their school to put global health into their core curriculum. We've got guidance on ethical electives. We run about 60 exchanges with different countries, and the aim of this is through the IFMSA, who does thousands of exchanges. And our aim of our exchanges is to make sure that they're sustainable and slightly different from kind of more traditional elective to hopefully be more ethical. We also provide guidance on global health resources, global health studies, and career advice. So how do our ACT area? We've got 30 branches around the country at medical-based medical schools, as well as non-medical-based universities, because we're a student network, not just for medical students. Our activities range between campaigns and community-led projects, from things like climate change and health to Students for Kids International Project, which is about sustainable projects abroad. One of our projects, which is particularly relevant to the topic today, is Crossing Borders, which is an international network of students who's aiming to improve the health of refugees and asylum seekers, doing this through community-led projects, as well as raising awareness and education to healthcare professionals, and campaigning and advocacy work to actually change health policy. And we do that on both a national and international level. We've got national working groups that work with various of these activities, and we provide training at all our conferences, our regional training days, locally, nationally and internationally, to try and give students the skills to empower them to get involved in any area of global health they wish. We have 2 big national conferences a year, and our Global Health Conference this year, held in London, was on conflict and health, titled Conflicted, the War for Health, where we looked at conflict and emergency humanitarian work and trying to translate it into effective sustainable development. And that was extremely successful. We got students from various different disciplines and tried to inspire them to get involved with more of our projects and campaigns, as well as giving them an education about conflict. And also we sit with various different external organisations who either provide us support, or we provide them support in terms of giving them a student voice and helping them to get students more involved with their campaigns. Because students are very unique, that we're still naive enough to believe that we can produce change. And often we have the time and the capacity to be able to make change quite quickly, because we're not quite, We work with the International Federation of Medical Students Associations, as I said before. We take about 15 delegates to their General Assemblies, which are about 1,000 students representing 100 different countries from around the world. And the UK was actually helped to create the IFMSA. So we do a lot of work with the IFMSA. So finally, in conclusion, Medsin UK is made up of a variety of different students, and everyone who gets involved with Medsin has the same dream, a fair and just world where equity and health is a reality for all. But the way that we do that is often very different based on that individual student's capacity, their interests and their skills. And we always like to kind of round it into our 3 streams of education, advocacy and action. Thank you very much.